Bleeding can occur from various parts of the body in a case of injury. This can not only be life-threatening, but also very distressing for the patient and even for the first aider. When you have to deal with a bleed, keep calm and trust your training. Bleeds often look worse than they actually are. With all types of bleeding, as with other first aid care, we must first make sure we've got our gloves on. The first part of controlling bleeding is the use of direct pressure. This could be by the patient applying pressure over the wound or using your gloved hand. This stops some of the blood from leaving the body, and it also assists in the clotting process, which is where the body produces fibrous threads to block the hole. With cuts, we can also apply a pressure bandage which is sterile and wrapped in plastic. You need to check the expiry date of the dressing to make sure it's in date. Ideally, we wouldn't use an expired dressing, but if it's all you have, then it's okay to use it. The dressing is a bandage with gauze fixed onto it. As you unwrap the bandage, you'll come to the pad. If there's an embedded object in the body, do not remove it. The first thing we do is apply direct pressure with your gloved hand and ideally a sterile gauze over the wound. You can ask the patient to do this, and this will give you more time to put your gloves on. Sit or lay them down, whichever is most comfortable for them, just in case they faint, as there's less distance for them to fall and hurt themselves. If serious, you can ask a bystander to call for an ambulance, or if alone, you can do this after the dressings are in place. The dressing is applied distally, which means furthest away from the heart and towards the body. The reason for this is to avoid forcing blood past the injury site. Apply the dressing with enough pressure to stop the bleeding, but not too much to cut off circulation. If blood comes through the first dressing, remove the dressing, check the wound and apply a fresh dressing over the wound. Some dressings, like trauma dressings, can hold a lot of blood. So if you're at this stage, it's a serious bleed and you need to get medical help as soon as possible. Once the bleed is stable, you can put the arm into a sling. Once the dressing is on, check circulation by squeezing a fingertip to check for capillary refill. We've talked about putting a dressing on an arm, but the same applies to other cuts. If it's a cut to the body, you can apply direct pressure just using the dressing pad until the bleeding is controlled, or you may be able to bandage it in place. Finally, in all cases of serious bleeding, shock is a concern. So if they're going into shock, lay them down and elevate their legs if possible.